Hello everybody, Kemo Sabi here, coming at you with another video. This is off of ncbi and Alimuddin.gov webpage with the topic of Covid-19 and malaria, a symptom screening challenge for malaria endemic countries. Published online 2020 April 27th. Alrighty, and here we have it. With Pascalina Chanda Kapata, Ministry of Health, Lusaka, Zambia, Nathan Kapata, Zambia National Public Health Institute, Ministry of Health, Lukasa, Zambia, Alimuddin, Zumla, Department of Infection, Division of Infection and Immunity, University College London, and NIHR Biomedical Research Centre, UCL Hospitals, NHS Foundation Trust, London, United Kingdom. The unprecedented global coronavirus disease, COVID-19 pandemic caused by SARS-CoV-2, has rapidly spread to all continents. World Health Organization 2020. With spread to Africa has been slow, there are now increasing numbers of COVID-19 being reported from African countries who are preparing themselves for an exponential rise in numbers of cases. As of the 26th of April 2020, there has been 2,804,796 confirmed COVID-19 cases reported to the World Health Organization, with 193,710 deaths. In Africa, there has been 20,316 cases, with 839 deaths reported from 49 countries. In comparison, the World Health Organization Malaria Report indicates that there was an estimated 228 million cases and 405,000 deaths due to malaria globally in 2018, majority of which were from the Africa region. COVID-19 currently imposes an additional burden to the already overstretched resource-strapped health services, which are grappling to bring under control the high burden of existing infectious and non-infectious diseases, including TB, HIV, and malaria. Proactive screening for COVID-19 is ongoing in high malaria endemic African countries. A case of COVID-19 is deemed confirmed based on a positive laboratory test result for SARS-CoV-2 virus infection regardless of symptoms. Healthcare workers and community members alike are faced with an important challenge of quickly identifying symptoms and taking appropriate steps for laboratory investigation in line with the case definition based on surveillance or clinical characterizations. Key steps to identifying a COVID-19 case ultimately involves symptomatic or high-risk patients presenting to health providers with complaints of any of the following symptoms or travel history: fever, cough, shortness of breath, fatigue, headache, and others of acute onset or history of travel to affected areas or contact with an infected person. Thus, current screening approaches for COVID-19 are likely to miss approximately 50% of the infected cases, even in countries with good health systems and available diagnostic capabilities. Malaria shares some of the highly recognizable symptoms with COVID-19, such as fever, difficulty in breathing, fatigue, and headaches of acute onset. Thus, a malaria case may be misclassified as COVID-19 if symptoms alone are used to define a case during this emergency period and vice versa. Malaria symptoms appear within 10 to 15 days after an infective bite. Multi-organ failure is common in severe cases among adults, while respiratory distress is also expected in children with malaria, mimicking what is usually reported in patients with COVID-19. Human travel is also a significant consideration, like with COVID-19, when screening for a suspected case of malaria as well as means of curbing transmission. Also, both COVID-19 and malaria-infected individuals may be asymptomatic for a long time while transmitting the infections through the respective modes. Globally, all countries at very high risk of COVID-19 while half of the world is at risk of malaria, with sub-Saharan countries bearing the brunt of malaria cases and deaths, while Southeast Asia remain at higher risk of both malaria and COVID-19. Although in sub-Saharan Africa the scale of the COVID-19 outbreak is relatively lower than other regions, there are concerns that the situation may prove difficult with time, considering the already weak health system in the region. Thus, COVID-19 and malaria converge symptomatically and geographically in most World Health Organization regions. The definitive way to correctly identify the underlying infectious etiology is through laboratory investigation, and therefore availability of appropriate diagnostic capacity is essential for accurate surveillance and clinical management of cases. Currently, it is expected that a high index of suspicion is skewed towards COVID-19 given the alertness at community health center, country, regional, and global level. In addition, another challenge is that people with fever may preventively get tested for COVID-19 and sent home due to negative test result, and conversely, febrile patients may get tested for malaria when they may in fact have a COVID-19 infection. The other case scenario is that patients may have malaria and COVID-19 co-infection, and diagnosis and treatment of one may lead to missing the other. A single case of COVID-19 has the potential to transmit up to 3.58 suspectable individuals. Untreated malaria, on the other hand, has the potential to cause further community infections, which in turn continues to be a significant source of illness and deaths globally. Thus, undetected COVID-19 virus and malaria parasite infections pose an immediate health challenge to the individual and public health consequences for the community. Furthermore, there is concern that limited mobility and lockdowns will interrupt the supply of malaria drugs. There is no specific treatment available for COVID-19. Host-directed therapies, including repurposed drugs such as anti-retrovirals, zinc, nutraceuticals, chloroquine, hydroxychloroquine, are being considered. What is required for Africa is a low-cost, safe, orally administered therapeutic which can reduce morbidity, mortality, and duration of illness. The preliminary data on the use of chloroquine/azithromycin were encouraging, although the trial was not randomized or controlled. Conversely, a small controlled study published from China showed no significant effect. Several large randomized trials are now underway, and these will determine the usefulness of chloroquine for COVID-19 treatment. Countries are struggling to meet the testing demand for COVID-19. While the malaria test kits are widely available at each point of care, including the community level, there is need, therefore, for enhanced sensitization on the potential of COVID-19/malaria co-infections and further guidance to clinicians on the importance of testing for other causes of illness, more so in this period where there is much emphasis to early detect and isolate COVID-19 in a bid to contain further spread of the disease. Since malaria tests are relatively more available, we recommend that health workers perform rapid tests for malaria as they screen for COVID-19. This presents an opportunity to respond to two infectious diseases timely and reduce unnecessary morbidity and deaths. By rapidly ruling out malaria, the health workers can focus on the true cause of illness and administer appropriate management. The health and economic benefits/consequences in a real setting will provide valuable lessons for planners, clinicians, funders, and governments on integrated management of infectious diseases. This issue is more relevant for travelers and people in malaria endemic countries, as this is a season when malaria transmission is at its peak in sub-Saharan Africa. The Global Fund has already issued a guidance of the 4th of March 2020, urging countries to reprogram savings from existing grants and to redeploy underutilized resources to mitigate the potential negative consequences of COVID-19 on health and health systems. On an operational level, countries should look at how services for malaria and COVID-19 are organized so as to efficiently use the available resources. For instance, malaria supplies can be moved to the laboratories or sites where the COVID-19 testing is being done so as to reduce missed opportunities for malaria testing, as some patients may be lost if they are declared COVID-19 negative while in fact they may be malaria positive. The rollout of rapid malaria diagnostic tests together with point-of-care tests for COVID-19 when they are rolled out should be a priority. The reorganization of services at health facility level has been a useful approach in TB/HIV collaborative activities. There is a possibility that lymphopenia seen in patients with COVID-19 may increase vulnerability to malaria, TB, and other infections. As the world commemorates World Malaria Day on the 25th of April, 2020, in the midst of the COVID-19 pandemic, the challenge still remains on how to ensure the progress made in malaria control is not set back. Conflict of interest, none declared. Acknowledgements. All authors have a specialist interest in emerging and re-emerging pathogens. Dr. Nathan Kapata and Sir Professor Alimuddin Zumla are members of the Pan-African Network on Emerging and Re-emerging Infections, Pandora ID Net webpage, funded by the European and Developing Countries Clinical Trials Partnership, the EU Horizon 2020 Framework Program for Research and Innovation. Sir Zumla is in receipt of National Institutes of Health Research Senior Investigator Award. Hopefully you enjoyed the write-up, everybody. It'd be awesome if you leave me some comments. Great if you hit that thumbs up. And peace. We'll see you in the next one. Roll till the wheels fall off. Bye.